歡迎大家嚟到今日嘅
Welcome to today's COVID-19 press briefing. Today we have the Undersecretary for Food and Health, Dr. Choi Taek-yi, and Dr. Chang Shuk-kwon for Center for Health Protection, Dr. Lau Ka-hin, Chief Manager, Quality and Standards of Hospital Authority. Undersecretary, please. Good afternoon, friends of the media and members of the public. In the period between January the 12th to January 18th, Hong Kong recorded 381 COVID-19 cases. Local or locally linked cases accounted for 365 cases. 32% were untraceable cases. In the most recent week, between January 19th to January 25th, 494 cases were recorded, whereas local and locally linked cases accounted for 469 cases, and untraceable cases made up 41% of the total. In the past 2 weeks, asymptomatic cases made up 36%. As you can see, our epidemic situation remains severe. Therefore, the social distancing measures that are due to expire this Thursday will be extended for 7 days until next Wednesday, February the 3rd. In order to cut off community transmission chains, the government from late last month expanded the scope of compulsory testing to include buildings with 2 or more unlinked cases. They will be put under the compulsory testing notice. Separately, based on our risk assessment, on January 15th and January the 19th, we delineated specified areas in Jordan and Sam Shui Po to ramp up compulsory testing in a targeted way. All residential blocks in the specified area, which include composite buildings, if 1 or more unlinked cases is reported or its sewage sample tested positive, demonstrating the risk of infection, the building will be subjected to compulsory testing notice. Over the past weekend, we issued the restriction and the testing notice for the first time, designating a part of a Jordan as a specified area, requiring residents inside to get tested as arranged by the government and stay in their premises throughout the period. During the declaration period, we collected over 7,000 samples. And during the operation, we identified 13 confirmed cases. We also identified over 40 close contacts and sent them to quarantine at quarantine centers. To further cut the community transmission chain, from today we shall step up the compulsory testing at specified areas. Details are as follows. First, the original Jordan specified area will be expanded, and it is now eastbound by Nathan Road, southbound by Austin Road, westbound by Ferry Street, Manchang Street, and Manwoo Street and Canton Road, and northbound by Kansu Road. Second, we will designate a Yau Ma Tei Mong Kong specified area, eastbound by Nathan Road, southbound by Chung Fong Street, westbound by Ferry Street, and northbound by Dundas Street. Thirdly, there will be a specified area in Hong Ham, which is northeastbound by Station Lane, southeastbound to Chuan Au Street and Poliris Street, and southwestbound by Winslow Street and Hong Kong South Road, northwestbound by Chatham Road North. Finally, we will keep the Sam Shui Po specified area. From today, in these 4 specified areas, as mentioned, any building with 1 or more unlinked confirmed cases or its sewage samples tested positive, showing risk of infection, it will be subject to compulsory testing notice. If a building has reported confirmed cases in the past 14 days, the government will prioritize sewage testing for these buildings and will be subjected to compulsory testing after being determined as at risk. Since the specified areas may carry a higher transmission risk, we encourage those local residents who are not compulsory testing subjects to get tested as well. We will add more mobile specimen stations or extend the operating hours. These mobile stations will provide free tests for all local residents, whether they are subject to compulsory testing notice or not. The compulsory testing subjects can go to any community testing centers across Hong Kong to receive their free test or get tested by any government specified testing method. We will monitor the development of the epidemic and consistently review the compulsory testing arrangements based on community risk, including whether to designate new specified areas or restricted areas. Thank you. Dr. Chang, please. We've confirmed over 64 cases, and case number is 10160 to 10223, which include 29 female and 35 male, aged between 1 to 72 years old. There is one imported cases. The other 63 are local cases. In these local cases, 21 of those are of untraceable origin, 42 cases with linkages. The 3 Queen Elizabeth Hospital nurses are confirmed. The case number is 10172, 10173, and 10178. The Department of Health staff is now confirmed case number 10223. Regarding the government specified areas, some of the buildings will be included or subject to compulsory testing notice. Outside the specified areas, we have 2 or more or buildings with 2 or more units affected, which include Chun Wan, Yongsan Chun, and Yanfu Court of Tinfu Court House. And in the sunshine specified areas, Azhou Daiha 254 and 258 Changsha Wan Road and Upliu Street 241. And inside the Jordan specified area in Manfai building of Man Yun Street and 115 Shanghai Street. And in the Nathan Road 491 to 493 Chin Mong building, and also in the Hong Kong area there's the Baker Street Chung Lok building. We need to Prospect building of Nathan Road. We need to confirm the addresses to ensure there's no repetition. And that's the end of today's report. Dr. Lau, please. As of today, 9 a.m., the hospital authority have reported a total of 103 cases. And over the past 24 hours, 2 public hospital patients have passed away. Case number 6850. And she's a 86-year-old female patient with a chronic condition. And on the December 4th, she was admitted to Princess Margaret Hospital. And on 28th of December, she was transferred to North Lantau Hospital to continue her treatment. On the 11th of January, she tested negative to COVID-19 as her pneumonia condition worsened and passed away on 11:17 p.m. Another case number is 9542. A 90-year-old female patient with a chronic condition. She went to see a doctor earlier and confirmed with COVID-19. And on the January 16th, we admitted to Queen Elizabeth, and her condition deteriorated and finally succumbed on 12/37. The hospital authority regret the passing of these patients and would provide appropriate assistance to their families. And currently, we have 168 patients that passed away. As of 9 a.m. in the past 24 hours, we have 45 patients recovered and discharged. Currently, we have 9,101 patients recovered and discharged. And of the day, 9 a.m., we have 852 patients scattered across 72 public hospitals and Asia World Expo Community Treatment Facility, and 34 in a critical condition, 32 in a serious condition. The 786 patients are in a stable condition. The negative pressure beds stand at 1,220, utilization at 71%. The negative pressure wards stand at 672, utilization at 77. I have 2 items to report. First, on the radiology department at Curator's Medical Center, a commuter imaging room ventilation system at Curator's, on the 23rd of January, it conducted a replacement exercise. And it was planned to install a 2 high efficiency cyclic filter to promote ventilation. According to experts, once we activate this filter, it will take 70 minutes to purify 99% of the contaminants in the room. On 25th of January, the hospital noticed that the examination room since the 23rd of January, that this purifier has not been installed. On the early hours at around 1 until 24th of January, a confirmed patient have had a imaging test and a scan and spent about 5 minutes, and subsequently 71 patients had took a scan in that room, and the patient who took the scan in the 1 in the morning was on high oxygen, but also wore a mask with filtration device. The staff responsible for disinfection accompanied the patients had wearing appropriate PPE. The infection control and the engineering team have conducted a site visit. The chief infection officer and the CHP have also conducted a risk assessment. And have all the patients subsequently have been wearing masks and spent quite a few minutes in the room. Thus, no staff or patients have been classified as a close contact. There was 1 staff and 10 patients are classified as other contacts and will be subject to medical surveillance and testing. Acting out of caution, the Caritas will contact the patients and will arrange testing for them. The hospital will also refer the patient discharged to CHP for follow-up. The hospital hopes for the patient's understanding.
Another follow-up regarding the QUE hospital. 3 medical wards stopped receiving new cases yesterday. Given that we're now in the peak of the winter flu season, the wards are under a lot of pressure. At the moment, the emergency ward in the hospital still provide normal service. The ambulances will continue to send critical patients or those who suffer serious injuries to the A&E ward. For those with lighter which are not in serious conditions, they will be diverted to the Caritas, the Kwangwa, and the United Christian Hospital in order to reduce the pressure on the Queen Elizabeth Hospital. But patients receiving treatment at the emergency ward in the QE will not be affected. We will advise patients with lesser symptoms would seek treatment in the outpatient clinics. It is now Q&A time. Please, tell us the organization you represent before you ask your questions. The lady at the front, Oriental Daily. Since the implementation of compulsory testing, the Bureau had never announced how many people have breached CAP 599. So since the date of implementation, how many people have breached that notice, and how many prosecutions had there been, and had there been any penalties? And if not, does it mean that this measure is simply not working at all? This morning, the CE said that there are 200 odd people in the restricted area did not take the test. So how do you follow up on that? And also, Professor Yun said that Block 5 of the Laguna City, there are also people who have not received the test. Now, regarding CAP 599 and the requirement for mandatory testing, the original intention is that through a legal basis, people who need to be tested should take the test. Over our past operations, whether it's the notices and guidelines issued by doctors or for the designated buildings, we have taken law enforcement actions. While I don't have the accurate numbers with me, but earlier one reporter asked about operations were on last Sunday and the numbers concerning Laguna City yesterday. Based on information available to us, the Home Affairs Department, when assisting the officers in taking enforcement action, it is easier for them to carry out the operations in public housing estates or buildings with owners' cooperation. It is easier for them to obtain data to find out who are the people living in the various units. And at the inspection center, they can also arrange for preliminary registration. And when the procedure is completed, they will collect the data again to find out to verify the number of people who have taken the test. Now, people who live in the area may not take the test in the temporary testing centers. They may take the test through other channels. So we'll take some time to verify that. If we cannot identify these people, only then will we submit such name list to the departments concerned for follow-up. So I believe we will continue to do that. Sorry, the speaker's not speaking in the microphone. Have you made any prosecutions? We've asked the Food and Health Bureau, and they refer us to the Department of Health, and the letter also refer us back to the Bureau. So who is responsible for prosecution if there's no deterrent effect? So is it unfair for the people who have taken the test? Now, regarding the compulsory testing order issued by private medical practitioners, I understand that some people have already been sanctioned and have to pay a fine. But as for the numbers concerning the public housing estates, we will provide such data when they are ready. We will let you know in due course. The gentleman to the right. Hong Kong 01. An air purifier was not properly installed in a hospital. Why did this happen? What caused this loophole to happen? And you have 71 patients who have who have undergone treatment there. Why is it that you only have 11, other contacts? Secondly, the government announced today that you will provide basic service. But at the Cheung Kua Wan, Cheung Sha Wan government offices, 3 departments has to be closed down because of the pandemic. So if you reopen the service there, would it be easier for the virus to spread? And you have patient number 6850 who passed away. Why is it that, she was tested negative? Has she ever been tested positive? According to our information available to us, on the 23rd of January, we plan to replace the ventilation system. We haven't found out the reason as to why the purifier we intended to install there had not been installed. We're still checking the procedure just to find out what actually happened, which resulted in the 2 air purifiers which should have been installed to enhance the air filtration. Was not installed. Hopefully we'll be able to find out the reason so that we can that such an accident will not happen again. As for the number, as I said, at 1 a.m. on the 24th, we have 1 confirmed COVID-19 patient who undertook an inspection there. Basically, the patient was taking a CT scan. When she was there, she used high-density oxygen. She also wore, oxygen filtration mask. According to our infection control department colleagues, they made an assessment and decided that the risk was very low because the oxygen mask she wore fully, cover up her mouth and her nose, and the air she breathed out was filtered, and therefore the virus should have been filtered out. But for the sake of caution, all the patients who took the procedure afterwards, for patients who took their, had the scan after that patient, while they were wearing the scans and they were not regarded as close contacts. But for the next 10 patients, we still categorize them as other contacts. So how are they different from the other patients? Now, for the time being, for the other contacts, we are now conducting more frequent, tests for these patients. For those who are not other contacts and who've taken the test, they will be tested twice. For the others, they will be tested. They have to undertake 3 tests. For the other contacts, they would have to be subject to medical surveillance for 28 days. So this is what we mean by other contacts. There was 1 staff who helped with the scanning of the patient wearing the oxygen mask and the following 10 patients. For the other patients, they were not contacts or other contacts, but we will still arrange for them to undertake a COVID-19 test. I understand that we will arrange for them to take 2 tests. We will contact these patients. Some of them are patients who attended the outpatient clinics. Some are actually inmates of the hospital. For those who have been discharged, the CHP will follow up on these cases, and the CHP will help us identify these patients. Did you also ask about patient number 6805? The person who passed away, she was tested negative and then passed away. Before she died, did she she become a positive case? After she was tested negative, there was no further test showing that she was positive. After the patient was tested negative, it simply means that the viral load in her body is very low so that we cannot detect the virus and there is no risk of transmission. So the Center of Health Protection may stop the isolation order, quarantine order. while she did not have any virus on herself, she was suffering from chronic disease, and she was also suffering from pneumonia and continued to receive treatment. She was undertaking treatment at the Northland Hospital, but her pneumonia deteriorated, and at 11 something last night she passed away.
Next, on a question on government service. And what is the DH assessment that with the resumption of public service help spread the virus? Are you referring to the Changshawan office? And the clinic where the doctor worked will be closed for 14 days, and the adjoining permit offices, burial permit cremation office will be closed, and the staff will be sent to testing.
English questions from Malaysia English News. First, on the new designated regions and zones, can the authorities tell us a little bit why Yau Ma Tei MK and the Hong Kong areas are now considered as designated regions? Like, is there a standard as to why these areas are kind of included in the zones right now? For example, like how many cases they have received in the past 14 days? Because last time, Sham Shui Po residents are also very confused as to why they were included in the designated zone, since there are many cases outside of the zones but not really inside. And second question, how many, do the authorities have an exact number of buildings that will come under mandatory testing after these new zones are, well, after Yau Ma Tei and Mong Kok and Hong Kong are added into these designated zones, and then the Jordan area is expanded? And third question, the government has started, or will start to resume the provision of some of the basic services from this Thursday. But looking at the current outbreak situation, and you guys just extended the social distancing measures as well, is it appropriate for government departments to kind of start resuming these kind of services? Thank you.
For the first question, I think there will be a basket of factors that government would consider in expanding or modifying the designated areas. Well, the first designated area, which is located in Yau Ma Tei Jordan area, has an obvious reason, because since early January or mid-January, there are a significant outbreak in that region, probably partly related to some construction site outbreaks. And because the number of cases has markedly increased in that particular area, and also because of the conditions of buildings, they were rather poor with substandard management, and also the speed of increase in number of cases or the persistence of the outbreak would lead to the conclusion that the area should be subjected to a more stringent testing protocol. So that is the first designated region. And because of that experience, as C has elaborated this morning, when we decided to, we're going to decide to have more similar designated regions, we consider those factors that I've mentioned, and also we might initiate the action before the outbreak become very significant. So that is the reason why we added those new designated areas in the regions that I've mentioned earlier, the new Mong Kok area, for example, because also of factors that we have considered before, like the buildings are rather old with not so satisfactory management, and the number of cases or the number of buildings affected and the locations of those buildings are rather concentrated. So we would like to act early and impose a more stringent testing protocol. And I missed your third question. Can you repeat your third question?
My second question is, do you have an idea on the exact number of buildings that will now be kind of under the mandatory testing order now that these new zones are drawn up? And my third question is regarding government will start resuming providing basic services from Thursday, but is it appropriate when the epidemic is still kind of ongoing in such a serious situation?
Sorry, I still miss your third question. Because
The third question, the provision. The government will start providing basic public service from this Thursday. So some government departments will start resuming some of these services. Is it appropriate to start kind of providing these services again when the outbreak is still very serious?
yeah, the consideration of the control measures and also the service to the public has to be balanced. I think we are providing service that can meet the very basic or urgent demand of the public, so as to maintain the society to function normally. I think that is our basic responsibility. For the second question, I think the number of buildings that is involved with the new expanded list of designated regions will be formally announced in a press release statement later this evening. Thank you.
好，下一條問題，手邊呢度黑色衫位女士。
The reporter in black. Cable news. Just now is reported there are over 20 untraceable cases. Do they concentrate in certain areas or certain building blocks, or do they belong in family clusters? In the Jordan specified area, the government measures not deterring enough that many residents did not get tested. And there are another 16 positive sewage samples, and with many more cases near the Yau Ma Tei fruit market. Would you consider larger lockdown operations for compulsory testing? I will take the question on the untraceable cases. For those belong to the family cluster, they could be untraceable, while as the others are traceable. Of these 21 untraceable cases, 2 are from the Samshui specified area, 2 from Jordan, and 1 in Hong Kong, and 1 in Yau Ma Tei. And there are other cases in different parts. For example, Tin Shui Wai, Tin Hau, Aberdeen, Cheung Wan, North Point, Song Shui, Chun Wan, Yao Chi Wan, Lai Chi Kok. That's it. As for the weekend operation at Jordan, and based on the characteristic of the area, the Home Affairs Department have deployed a lot of manpower to making house calls, and there are 3 or 4 units that did not answer the door. They put up notices and will attempt to locate the residents who were not present or did not get tested. I believe the work is ongoing. For the new Yau Ma Tei's Mong Kok specified area, we looked at the distribution of cases in those buildings in the past 14 days. The boundary we announced is really based on the distribution of cases. Main Pal Daily News. I'd like to ask about the specified areas. This one, the CE mentioned, hope that the compulsory testing can be more proactive and take action before the outbreaks happen. The Pitt Street cases have lasted for quite a few days. To delineate a specified area now, are you acting behind the curve? And how do you evaluate the efficiency? What criteria do you set in delineating a specified area? A question about the EU, who plan to place restriction on vaccine exports. Have you found out from the EU and the vaccine makers on the arrangements? if the restrictions are in place, will it affect the timetable of vaccine supply? A third question follow up on the other reporter's question. In the Jordan specified area, there are over 200 residents who didn't get tested. How would the administration follow up, and what kind of punishment would you mete out?
Regarding the question of vaccines, I believe colleagues in different departments, including, for example, if you're talking about the import and export or the latest information regarding vaccines, I believe the Department of Health will closely monitor such news and information for the government's consideration. As for the different districts, with the development in the last couple of weeks is such that, take for example in Yau Ma Tei, we have a very large cluster, partly due to people who work in 2 construction sites live there. And given the condition in those buildings, the epidemic spread rather quickly. Of course, the development in different districts, I think we have to, we may not be able to adopt a very simple formula to make predictions as to when we will have an outbreak first. So no country or no jurisdiction will be able to come up with an accurate formula to determine which neighborhood or which area will definitely have a major outbreak. So we are now basically looking at the information available to us, for example, the clusters which appear in the last 14 days and so on, and the cases in the buildings, and the characteristics of the neighborhood, whether or not the buildings are old or they are closely packed together, and the frequency of the outbreak and so on. So we'll look at a cluster basket of all these factors when we delineate the specified area, so that we will be able to conduct more stringent testing in such an area. As for the Jordan neighborhood, though, for those people who did not take the test over the weekend, the Home Affairs Department will continue to follow up on those cases. Next.
The first question is about the Sinopharm vaccines that mentioned in the meeting earlier, as Carrie Lam has asked for Beijing's help in securing this vaccine. So there is currently no stage 3 clinical data for Sinopharm available, and then experts have said that they need this information in the vetting panel. So may I ask if the government will follow the procedure for Sinopharm and ensure that the vetting will not be bypassed for the sake of speed, to expedite the process? And the second question is about any updates on Laguna City, like, where is the source from Block 5 coming from? And also, how many new infections are from Block E, Unit E in Block 5, because there was one prelim case yesterday. And how many people were evacuated and sent to quarantine in total? And also, last question is how many prelim cases for today? Thank you.
Sorry, I don't hear the first question very clear. I know it's about vaccine, but what is the specific question, please?
Because Carrie Lam has asked Beijing for the help to secure the vaccine so far. But then there's currently no clinical data in the stage 3 process. So will the government follow the procedure to vet through Sinopharm and ensure that it will not be bypassed and it won't be expedited faster?
Okay, thank you. Well, I think the simple answer is CE this morning has also recapitulated that the 599K, the regulation about the emergency use of vaccine for COVID-19, has to comply with the requirement under this regulation. That is efficacy, safety, and also quality. So any other vaccine that is going to be introduced, the government for a particular use in this situation against COVID has to gone through the very stringent scrutiny by the scientific committee and also the expert advisory panel before we provide to the public. Thank you.
For the Laguna City, last night, 78 persons have been sent to the quarantine camp. And Except for the preliminary positive case, there are no other new infections. For the preliminary positive case, it's still preliminary positive because of the specimen transfer, but the patient has been managed as a confirmed case. There are more than 50 preliminary positive cases at this moment.
好，最後兩個問題。
Last two questions. Lady in red. Economic Journal. Regarding the what is the criteria for mapping the specified testing area? You have new areas, Yau Ma Tei and Hong Kong. How many new cases had there been in that district? Do you have any numbers to decide these two areas have been designated, specified areas? Regarding the 3 nurses at the QE hospital, have you found out the source of the infection? Are they linked cases or not linked cases? Were they infected within the hospital or outside the hospital? Regarding the ventilation system at Caritas Hospital, I couldn't hear the dates very clearly. When did you decide to replace the ventilation system, and when did you find out that the filtration system was not installed? And for the 2 buildings in Luk Yang San Chun, Block R, and the Tin Shui Wai case, how many units are there in total? Regarding the specified areas, the setting up of the specified areas and the adjustments to those areas, we do abide by some broad principles. We will take into consideration the number of cases, the speed of the spread of the virus, and the buildings with cases, are they more close to each other? We also look at the living conditions of the building and whether they are and how well they are managed, and whether there are environmental factors resulting in cross infection. Although Yau Ma Tei was the first specified area, well, the need for the lockdown is obvious because the cases were spreading very quickly, and there's a trend for the epidemic to spread to the neighboring buildings. So another principle we follow is that we need to be forward-looking. In a particular district, if there are similar factors, although there are not many cases yet, but based on those principles, there is a need for us to tighten the need for those buildings to be subject to mandatory testing notice, so that we'll be able to identify the cases earlier. I believe we do not have any hard numbers, but we will have to consider a basket of factors. For the Luk Yang San Chun in Tsuen Wan, we have 2 cases today involving 2 units, but earlier there was already another case. So altogether we have 3 cases in Luk Yang San Chun. For the unit earlier, there were 3 confirmed cases. For the 2 units, there is 1 confirmed case each. For one of the units with a confirmed case, it's located on the same floor as the other unit. For the others, they are not of the same, unit or flat number. In Tin Shui Wai Tin Fu Court, there are 2 units on different floors with different orientation. For the Queen Elizabeth Hospital nurses, for the 3 nurses, we have not yet been able to confirm the source of infection. But one of the nurses, as we said yesterday, lived in a building where there is a confirmed case. In the course of her work, she had not been in contact with patients with COVID-19 infection, and she was also wearing proper PPE while at work. So we believe it's more likely that she was infected in the community. As for the other 2 nurses, the one working in the isolation ward and the other one who had worked for 6 weeks in the isolation ward, for these 2 nurses, we're still tracing the source of the infection. So we haven't found out yet where they were infected. For the nurse working in the isolation ward, 10172, that's the case number. For the nurse who have worked for 6 weeks in the quarantine, isolation ward is 10173. And case 10178 is the nurse who live in the building where there have been a confirmed case. I also like to talk about the situation at Caritas Hospital. The CT scanning room has a ventilation system. Since we need to replace that system on the 23rd of January, early on we've made a decision, so we stopped the operation of that system for an upgrade, and we have to find a way to improve the air filtration system. We had an infection control expert who recommended that we should install 2 HEPA air purifiers with HEPA filters in the CT room in order to increase the enhanced air ventilation. We haven't found a reason why this mix-up happened. Anyway, the air filter had not been installed there. It wasn't installed on the 23rd. No COVID-19 patients were treated there, but on the 24th of January, there was a patient with confirmed COVID-19 virus infection, had to take a scan, and it so happened that he was scanned in that room. And that patient took the scan at midnight on the 24th, and she needed to use high dosage oxygen. Fortunately, the patient wore a mask with filtration function, so the risk of infection is very low. She only took the procedure only took 5 minutes. After that, the room was entirely disinfected, and this is our standard, practice. Whenever you have a patient who is a confirmed case to have gone to that CT scan room, we would disinfect the room afterwards. And also, according to our procedure, the room will stop using the room for some time. In this case, we stop using it for 90 minutes, so that by replacing or filtering the air, we can filter the air. On the 25th of January, our staff discovered that the 2 air purifiers have not been installed. At 2 p.m. on the same day, the 2 purifiers were immediately installed. So after 2 p.m. on the 25th, those 2 air purifiers were already operating normally. So from midnight at 1 a.m. on the 24th to 2 p.m. on the 25th, 71 patients during this time, including inpatients and patients referred to us by the outpatient department who've come for the CT scan. There were a total of 71 such patients. The infection control unit and the CHP have checked the timing and confirmed that 10 patients they actually had their scan close to 1 a.m. and therefore we regard them as other contacts. We believe that the risk of infection is very low, and all these patients taking the tests were wearing masks. We will also require them to be subject to 28 days of medical surveillance. For the other 61 patients, we will arrange for them to take 2 COVID-19 tests for the sake of caution. Although the risk of infection is very low, nevertheless, we would require them to take 2 tests. Regarding our staff, 1 staff member had been in contact or helped actually with the scanning of this patient at 1 a.m. And after some time, he also worked there, so we would categorize him as other contacts, and again, he would need to go take 3 tests and be subject to medical surveillance. We are also contacting, patients who are not inmates of the hospital to come back for testing. And we would ask for the indulgence.
第二排。
In the second row, now news. Just want to clarify. According to Undersecretary, the over 200 persons in Jordan will be referred to the Home Affairs Department. Or I heard from the CE they will be referred to the CHPs. So which department should we report to? So what's the progress? And how do we have any preliminary positive cases? I believe this is a process. Upon the completion of the operation, the HAD, well, for those units who did not respond to door knocks, they had put up notice, and afterwards, the staff make sure that if the residents had returned. I believe they need some time to collate such information or manage to locate all the residents or to ascertain that the units who did not respond were vacant. It will take some time. After we consolidate such information, we'll refer to other departments for follow-up. I believe that the process is still underway. Well, as of today, as of last night, 10:30, and the testing of the 3 medical wards in A10, 34 staff, 33 have been tested. They all came back negative, and 1 will get tested today. As for A10 ward, as an isolation ward, all the patients are confirmed cases, therefore will not particularly test them. And for A6, 51 staff, they all tested negative. There are over 70 patients, and over 50 have been tested. The remaining ones have been transferred, and we are tracking them down. And so far, the tests came back negative. And for the E6 staff, there are over 77 staff. We tested 74 of those, and the remaining 3 are pending tests, and so far they all came to negative. And so far, all E6 tests turned out negative. The environmental samples, for those who completed, they have returned negative. We'll test the remaining ones as well. Thank you.